no Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Okay. See, I don't need no reason.
Radio Al Ansar 24/7, 365.
Hard times, we were living some dark lives. We did not know where we're supposed to be. We did not know what we're supposed to need. We took the time out to teach us, so that the guidance would reach us, and you know it really. Muhammad ya Rasulullah, Muhammad ya Rasulullah, عليك وسلم المولى محمد, عليك وسلم المولى محمد. I look up to the best of the men, and I'm working on the test to the end, by following the message he sent, and try turning these lessons into action. Oh, I pray for the day that I see you in my dreams. Rahmatul Alamin, for all humanity. You gave me the blueprint of life, taught me the rules and the right, shining like the moon in the night. This is how we speak on your life. We was all in need of a guide, and the Lord you sent us.
A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM. I am Shubnum Ismail on the Pulse show, capturing the heartbeat of our community. So, scorching truths, protecting your skin, saving lives. This show is heating the conversation today, and we're honored to have Dr. Anika van Vuren, a distinguished general surgeon, at our Peter Marisburg studio. Dr. van Vuren, good morning, and it's great to have you with us.
Good morning. It's such a pleasure to be here.
So, listeners, it's National Burns Week, and we are diving into prevention, treatment, and resilience. We'll be discussing the latest on burns care and sharing life-saving tips. So let's get to know our guest, Dr. Anika van Vuren. Dr. Anika is passionate about burns, and she is currently a surgeon from Harry-Gwala Regional Hospital. With a journey that took her from Pretoria to Bloemfontein, Port Shepstone, Impongeni, and Pietermaritzburg, Dr. van Vuren has dedicated her career to making a difference in burns care. Inspired by the brave survivors she met in the Nguyen Nelweza's burns ward and mentored by Dr. Nikki Altato, she's now leading initiatives with Interburns and Global Surgery to improve burns care in South Africa and Africa. A mom of two and wife to an amazing husband, Dr. van Vuren embodies resilience and compassion, and we are very lucky, as busy as she is, that she's sharing expertise at Al Ansar Pietermaritzburg. So, Doctor, thanks for joining us, and can you tell us about your role at Etondale Hospital?
I'm currently primarily working in burns. I am a general surgeon, so I do general surgical calls, but my day primarily consists out of taking care of the burns patients in Harry-Gwala Hospital.
So what is a typical day like for you in a burns unit?
We usually start our days about 7:30, where we have our handover. Then we see our patients. I typically have about 28 patients admitted at a time. We quickly have a once-over to see if everyone is still all right. And then a big part of our day is burns dressings. Burns dressings is usually a very painful procedure for patients. So we aim to keep our patients as pain-free as possible. We sedate them for every time when we do a dressing change, keep them asleep, monitor them, and then we do the dressing changes. It's also during this time where we look for anyone who's got any new infections, which unfortunately is a very common occurrence in our burns patients, and then we promptly treat that. And 2 times a week we have theatre as well, where we then start our morning early and we do skin grafts throughout the day.
It's a very delicate portfolio. So why burns in terms of your general surgery? What made you dive into that portfolio?
I think burns sought me out. I started working at Ngwelezana as a community service doctor, and I was just really inspired by especially the pediatric patients. The kids who had gone through so much, through this whole trauma of getting burned, of going through this injury, the daily or every 3 days they get new dressings. It's a painful procedure, and they were so joyful and resilient. And I realized that this is somewhere where if I put my heart into it, I can make a big difference. The recovery journey of a burns patient, going through all of that trauma and going back to normal life, that is exceptionally rewarding. And that is what I live for.
I can hear how passionate you are, and I'm sure that you actually go through the empathy and keeping the family above water during this terrible time that they normally have been affected. And there's degrees of burn, so you go through the different categories. So, can you tell our listeners, how does Etindale Hospital's burns unit differ from others in the region?
I think one very fortunate thing is that I have dedicated burns beds. So I've got a high care where I have 8 beds and an exceptionally dedicated staff where the nursing staff really have compassion and empathy for every patient. I really appreciate those ladies because without them, we wouldn't be able to do what we do. And then I also have for our step down, we've got an excellent pediatric ward that help us take care of the patients, and then a female and a male ward. I also have theatre 2 times a week, which enables me to do these skin grafts and get these patients back to normal life.
And tell us, what's the most common causes of burns you see at your facility?
Unfortunately, it's the preventable hot water burns. And these are specifically in our kids. The most common one we see is bath injuries. So when water is heated up and it's either poured in without cold water being poured first, or it's younger kids preparing a bath and then someone falls into the hot water. Those are often very severe burns, and patients die because of these burns.
That's interesting. So I think it's good that we can actually educate some of those learners at school level as well, and probably into the communities, because you obviously in your area of Etindale, you go out into quite a vast rural area, I'm assuming.
Absolutely. So we cover the whole of the west of KZN.
So how do you assess the severity of a burn injury?
So firstly, there's a few things we take into consideration. The first thing is the expanse and the percentage of the burn. So we look at how much of the body surface is burned. That would determine how active we need to be. So does the patient need some fluids? Do we need to give them extra nutrition? It has a big influence on their outcome. Sometimes patients are burned so severely that there is unfortunately nothing more that we can do for them. And then the other thing we need to look at is the depth of the burn. Superficial burns usually heal within 21 days, but then anything deeper needs surgery. These wounds can heal by themselves, but it takes months to years, and then they heal with severe scarring, which has impairment on their function.
I know the skin is a very delicate organ, and we spoke a little bit earlier, and I was fascinated that you guys also do skin transplants with regards to burns. Would you like to elaborate about that?
So we do skin grafts as the primary treatment for burns. Unfortunately, in South Africa, or especially in state sector, we can't really use any donor skin from cadaver banks. So the best treatment is using a patient's own skin to transplant onto the wound. So we often harvest. So that means we use a big shaver. It's something called a dermatome, to take skin from the thigh or from other open areas on the body, sometimes from the back or the upper arm. And we transplant that skin by taking a superficial layer back onto the wound itself. This usually then enables us to review the wound within 5 days, and they should heal within 21 days. They should heal over that skin graft as well as over the donor site.
And what's the initial treatment process for a patient with severity of burns?
Once they come into the casualty, we assess them for airway, make sure that all the other systems are fine. They get a drip during this time, and then they get sedation. It's very important that we scrub the wounds to be able to see the severity of the burn. We take away all the dead skin, see how much the extent of the burn truly is and what the depth of the burn is. We also dress the burns then, give the patients their fluid resuscitation, and then we start with the pain care and the nutrition.
I know when I'm actually at the stove, or I actually am ironing and I have a little burn, the pain is excruciating. So can you actually maybe tell us how you manage burns for your patients?
So the pain in burns is the biggest problem. It's not just the organ failure, it's this constant ache that patients have, and it's a dynamic process. So first, when a patient comes in, we give them their first dose, usually intravenously, so within that drip, and they get sedation. So in that sedation, there's also a pain medication mixed in. Then as they go through daily and continuously, we reassess, are we on top of their pain? If they have any breakthrough pain or the patient is still in pain, we need to increase their pain medication. And we are quite liberal because we acknowledge the fact that this is probably one of the most painful injuries that a patient can get. Also, if they've gone to theatre, I give them more pain medication. And then every sedation, we add on pain medication for them.
And you work with the multidisciplinary team, of course, because it not only affects their skin, it affects their wellness, the psychological side. And I'm sure that you also deal with a group of plastic surgeons to see where you can at least give the patient a better life.
Plastic surgeons are only based in Gray's Hospital and Albert Lutuli. So in South Africa, burns care is primarily managed by burns surgeons, or by general surgeons. So we do the initial resuscitation and the skin grafts, and then often only if there's complications afterwards, plastic surgeons will get involved. My multidisciplinary team consists out of occupational therapists, physiotherapists, and my dietitian and psychologists. They are so essential to care for these patients because covering the skin is only such a small part of it. Then we want the patient to be able to go back to normal life, have normal function, be able to use their limbs, but also get through this post-traumatic experience. And therefore, we need everyone on board. The nursing team is also absolutely essential to every part of this journey.
I know the multidisciplinary team and the nurses behind the scene, our unsung heroes, they do such great work. And in a few days, it's International Nurses Day, and we want to thank you for your resilience, for your empathy, your compassion, and your care and your concern, and what you really do out there around the world. So, Doc, what's the importance of fluid resuscitation in burns care?
So fluid resuscitation is essential for survival. It's something that needs to be started the moment a patient comes, and we often do that for 24 hours. With fluid resuscitation, it's very much a Goldilocks principle. You can't give them too much or you can't give them too little. It must be just right. So we have to calculate it initially and then adjust it to make sure it's exactly adequate for the patient it's given to.
And hats off to you in terms of your profession. Can you actually walk us through a typical surgical procedure for burns?
So the most common procedure we do is the skin graft, which would be a patient gets prepared the previous day. We explain often to parents, so most of my patients are pediatric, although I do have a lot of adult patients, that the patient is going to come back with 2 wounds. Because unfortunately, to be able to graft a burns wound, I need to create a new wound. And that new wound I create is often the most painful. So the patient gets taken to theatre. My anaesthetists are key here. They often do blocks and give specific analgesics for that area that I'm going to be working on. I take the skin off that area, we control the bleeding, and then we clean the wound that is affected. If there's any dead skin, we remove it, and then we place the new skin on. And then that's the wound that we would review.
So let's talk a little bit more about skin graft. How do you determine when a patient needs a skin graft?
It's as soon as a patient has a deep partial thickness burn. So if we look at the skin, it has different layers. We have the top layer, which is the epithelium. And that part, if it gets damaged, it can heal very easily. And the hair follicles is key because that's where the cells grow out of. The moment that the burn is deeper and it starts destroying hair follicles and it starts going into the dermis, that deeper wound needs a graft. We also get deeper wounds where it goes into the fat or even into the joints. Sometimes burns are so deep that patients end up requiring amputations.
So if I'm correct, I think you mentioned earlier you have a 28-bedded unit.
Yes, I've got about 28 beds in the whole hospital.
And are your beds always full? And do you think you need more beds in the province or in Pietermaritzburg?
Always. Always. So unfortunately, like summer, we're usually lucky and we do have some open beds. But as the weather is getting cooler, we do require more and more beds. We use something called the Vuren app quite a lot to manage patients at base hospitals with smaller burns, just because we don't have the capacity to take all of them. At Gray's, we have even less beds, so we've got a total of 12 beds at Gray's Hospital. So at Edendale, we've got our most beds, but even that in the heat of summer or peak of summer, it's definitely not enough.
That is why it's very important that public-private partnership is important, that we help each other. I mean, I'm coming from an acute private sector, so, we reach out and we try to help, but I'm sure that industries, we can connect, we can see where we can help each other and take care of our patients. Morbidity and mortality. In saying that, I know you spoke about the multidisciplinary team. Can you tell us the importance of the physiotherapy in the burns recovery?
I think when I speak about physiotherapy, I need to speak about occupational therapy as well. So often when we think about burns, some of the most crucial areas that can get burnt is the hands, the feet, and like the flexor areas on the arms, the shoulders. So what we usually do is we assess these patients from the beginning and we see that they are at danger of losing their function, especially deep wounds over the hands. We get our occupational therapy team involved from the beginning to start with movement and then to create splints, because the last thing we want is these patients to end up losing their function. And we get something called a burn claw, where all the hands get basically locked in a flexion position and they can't straighten them again. So we need to start addressing that early on. We also need to keep on moving these patients, and that's when we need our very dear but very tough physiotherapists who need to go through the pain. So we give the patients analgesia, but it's still very painful to do the rehabilitation and move the limbs. And our physiotherapists are key here in getting these patients to keep on moving, move those burnt limbs so that they don't lose the function.
So your day is not just a general textbook where you know that, okay, it's just going to be planned out. I'm just trying to picture your day where, your ambulance arrives, the type and caliber of the burn case that you're getting, it's never the same, and the severity, and how do you handle your emotions and dealing with the patients that come in?
I'm very fortunate to have a very good emotional support structure. And my mentor, Dr. Lota, has taught me a lot about just managing what's in front of you, because in the end, that's the most that you can do. So emotionally, I try and invest in every patient that's in front of me. And I try to give the most, but it is an emotional roller coaster. And unfortunately, other than most surgical disciplines, you can't stay on the sidelines while managing these patients. It is an emotional journey. I cannot say that I can admit any patient without getting involved with them, because they also stay with me for such a long time. So we try and give everything we can for every patient, and we celebrate our victories. And sometimes it does end up that patients do not survive, and we mourn with those parents and we go through the journey with them. But we try and live for those victories, the ones that come back and that are back into society, having normal lives, these kids that come and give you hugs and arms that were previously burned. That's what we live for, and that's what drives us.
That's absolutely beautiful. And speaking about Lent, what's the longest time you've had with your patients?
That's a very loaded question. I think the longest is 4 months that I've had someone admitted, and that's just as an inpatient. Then the outpatient journey starts, and that's often 2 years.
Okay. And how do you counsel patients and families on post-burn care?
So that is crucial and the most essential part, because once again, it's not just the skin I put on. That's just the start of the journey. So the first thing we counsel parents on is that this is where their work starts. Parents, especially for kids, need to be an active member in this, especially in patients with burnt hands. So here what we do is we counsel them on wound massage. We give them cream and teach them how to massage the wounds. Occupational therapists are crucial here again. They often need to wear splints at home, which we educate which our occupational therapists give to the parents and educate them how to use that. They need to come back to me every week. And especially with hands, the parents have exercises they have to do with the kids. This is sometimes very challenging because the kids don't always want to do it and sometimes painful. But the difference it makes is crucial. It's a difference between having a hand that works or a completely non-functional hand. And it's something I see in the clinic, parents who are invested, family who give everything to their little ones. You can see that hand coming back and you'll never say this patient had an injury in comparison with someone who will never be able to hold a pen or to be able to use their hand.
And I'm sure your biggest worry is to ensure that wound doesn't get septicemia and also to prevent any infections. So you obviously have to guide and also educate the families and the patient on wound management once they're actually discharged.
Yes, absolutely. So what we do is we try and do as many dressings ourselves as we can. Sometimes patients do need to go to clinics and we guide exactly on what needs to be dressed, how it needs to be dressed, how it needs to be cleaned. And that ensuring like nails are short and small things like that make a big difference. So whenever someone has a burn, because it often itches, we educate them to keep the nails nice and short so that they don't scratch and then cause new infection, especially after a graft has taken. And then that they must watch the wound. If there is a funny smell, if there is something concerning, they must come back to us sooner rather than later so that they don't end up with infection at home.
So intervention at its earliest is actually imperative to ensure that we get the best outcome.
Crucial, absolutely.
Listeners, we're going to take a short break. So when we return, we'll be back in conversation with Dr. Anika van Vuren, a dedicated surgeon in our city of choice, Pietermaritzburg.
بك الأرض والسماء والقلب بات يهتف لك بالصلاة أحسن الناس سيد ومصطفى خير الورى صلى عليك الرحمن وسلم وبارك على سيدنا.
Africa, are you ready?
2 days, a spiritual wave sweeping South Africa.
Dawud Islami brings to you a grand 2-day Ijtima aimed to bring out the best Muslim in you.
It's happening on the 16th and 17th of May at the Heartfelt Arena in Pretoria.
Buses scheduled to leave from Durban, PMB and across the country on Friday night and return on Sunday night.
Visit dawudislamikzn.co.za to book your seat.
Broadcasted live on Madani Channel and Radio Al Ansar.
Sallu ala al-Habib.
Sallallahu ala Muhammad.
واخفض لهما جناح الذل من الرحمة وقل رب ارحمهما كما ربياني صغيرا.
A mother's love, a mother's sacrifice, a mother's dua. This Sunday, join Kelly Ramazani for a special program honoring our mothers. Reflect on the beautiful status Islam gives to mothers, because in Islam, Jannah lies beneath the feet of your mother. Tune in this Sunday, 10th May from 9 a.m. to 10 a.m. only on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
أحسن ما يقال عندي بسم الله بك نبدأ في سلطان جسدي مع الزكي يا عين وحدة تبني شهدة يا محمد يا سيدي صلى الله عليه وسلم سيدي صلى الله عليه وسلم محمد سيدي صلى الله عليه وسلم. اللهم صل وسلم طول الدهر على نبينا محمد سيدي صلى الله عليه وسلم سيدي صلى الله عليه.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM. I'm Shubnum Ismail on the Pulse Show, capturing the heartbeat of our community. So Scorching Truths is on point for National Burns Week, and we are indeed heating up this conversation on awareness with expert insights on prevention, treatment, and resilience. So stay tuned with us as we unpack all. And I have with me Dr. Anika van Vuren, who's a dedicated surgeon in our city of choice. We're very lucky to have her in our first part of the show. She's unpacked exactly what she does at a burn center and how she makes a difference in touching lives every day. So, doctor, what's the biggest challenge in treating burns patients?
One of the difficult things that I think people don't realize is when you have a burn injury, you actually have loss of an organ. It's the primary part of our body that defends us against bacteria. And often we get patients through this first part where we resuscitate them and we give them the fluids, but the problem is that they're at risk of infection. And often, especially in the more severe burns, these patients have a hospital stay which is quite turbulent. and they do get multiple different episodes of infection. It's also that the journey doesn't end once we've done the skin graft or once the wound is healed. A burn is also results in scars that patients have to carry through the rest of their lives, and that has implications. So doing what we can for now, but also respecting patients who wear these battle scars after injury, and acknowledging what they've gone through and not judging the scars, which is the most easy thing for us as humans to do.
It's that season where we actually have our heaters and, all our electrical appliances at its peak. And, my husband's a senior firefighter, so he does tell me a little bit about the stories, the lower settlements and not taking care of the candles, and, it starts the fires, etc. So can you tell us, in terms of our listeners, what sort of tips can you share in terms of prevention of burns?
Firstly, when we start with looking after kids, toddlers are a mess. They are so busy and so difficult to keep an eye on. And we need to do whatever we can to try and keep harm out of their way, because they will find it. So for example, when we have kettles boiling, we must make sure that those cords do not hang low. They must not be within reach, because toddlers are curious and they pull down. They pull down kettles, they pull down tablecloths. If you have kids under 3, you should not have a tablecloth in your house, because they will find a way to pull it down. The same thing with when we have pots, to make sure that when we have pots on the oven, there is an adult close by. The children don't play in the same vicinity. Sometimes it's very difficult because it's a one-room house and the children have to be in the vicinity, but then someone needs to watch where things are being heated. Often what we see is a problem with one-plate stoves, where that gets placed on the floor and we forget about it, and patients get contact burns, so they actually fall on top of those plates. To make sure that whenever we are using something heated, it must be in a secure location. We must see what's happening in that area. The same with our insulation. When we're using electrical cables, make sure the insulation is proper over that whole cable, especially if you've got kids in the house who can grab the cable and get burned, because that's an often cause of electrical cables. Same thing with having sockets in the walls, to make sure your sockets are covered, that kids don't start putting their fingers in the sockets, because that's another way that kids lose their fingers because of electrical burns in that way. Another way to prevent it is when we do use candles, make sure your candle is put in a place where it's far away from curtains, that you do have a candle holder or something to protect it. And once again, far away from where kids are playing, because an accident happens so quickly. And whatever we can do to prevent that, we must. When it comes to bathing, just to reiterate, always cold water first. When boiling water, make sure that there is someone who is actually watching this, making sure no child can bump into it, no child can bump it over, and no child gets into the bath before cold and hot water is mixed, to test it before a child gets placed into the water. And then in terms of epilepsy, so a more common complication what we see is our epileptic patients who have uncontrolled epilepsy, and then they're cooking or they're busy working in the kitchen, and then they have a seizure. The problem is the moment they have a seizure, they lose all control of their body and they're often unconscious for a long while. They sometimes knock over something that can cause a fire, they get burnt, and they lie in that for a long period. So if someone has epilepsy, and especially if they have seizures, they should ideally not be working with anything fire, electrical, or heating related until their seizures are well controlled.
And Doc, the elderly, what are some of the common burns you see, and how does it start? Is there any preventative tips for our grandparents or our parents?
I think in the elderly specifically, just hot tea is a common injury we see, and then warm water bottles. If warm water bottles are used, especially now when the cold season is coming, make sure those lids are attached nicely. It must always be tested before it is placed on someone, especially in our demented patients who can't say when something is heating them too much, to avoid direct contact with our warm bottles. This usually causes superficial burns, but for our elderly, even a superficial burn can be quite severe.
And do you see a lot of gas burns from leaks?
Luckily, we do not see as many. When we do see gas burns, they're usually very severe, and it usually involves the whole house being burned down afterwards. But luckily, we do not see as many gas injuries here in Pietermaritzburg.
So, Doc, let's unpack the myths. What are some of the myths that you can share with us?
Especially in that first, once an accident has happened, first aid is key. And there's a lot of beliefs out there that I would like to rectify forever. So the first thing to do is cold water. Cold water is key whenever anyone has a burn. 20 minutes under running water for that burn, it decreases the severity of the burn, decreases the depth, and decreases the percentage of the burn. Often people put either egg, raw food, butter, oil, toothpaste. We've seen some dung even put on wounds because of traditional beliefs. And that all worsens the wound, because essentially what it does is it seals in that heat rather than cooling it down. Also, using ice is a terrible idea because it just worsens. Now you're adding insult to injury by putting ice on a skin that's already thickened, that's already in pain, that's already traumatized. And putting ice directly on it will be bad. Just normal tap water, 20 minutes of that before you go and seek help somewhere else.
Listeners, I hope you are taking note with our expert advice from Dr. Van Vuren, because this is very important and it's life-saving tips. Doctor, how does the team approach rehabilitation for burn patients?
So we often have our team rounds where we identify the patients that need splints, that need occupational therapy, that need physiotherapy. And we have to look at our percentage of burns of which patients need extra nutrition. Because when it comes to nutrition, your body you can't eat physically enough to supply the body with enough protein to recover from severe burns. We usually say about 15% burns, they need additional tubes. So often these patients come to hospital and we have to give them tubes in their nose to supply them additional feeds. It's not because they cannot eat, but because they cannot physically eat enough. Like a little 10-kilogram baby needs to eat a full chicken to actually supply them with enough feed. If they don't eat enough, the body will always take what it needs. The problem is it takes from your muscle and from your other organs. And that's why burns patients often end up being quite emaciated. They end up looking like starved patients just because the body is taking protein from all these other sources to try and heal this wound. And that's where our dietitian plays such a key role. Psychologists are essential, and especially again in the pediatric patients, the parents go through so much. Accidents happen. And even though people often speak of neglect or of intentional injury, most of the wounds we see are accidents. And these parents are so traumatized by what has happened. They blame themselves, they often get blamed by the family. And it's a lot to work through from a psychological point of view. And as a team, we try and address that as well. And then also to guide them on, this is a journey. It's only starting here. They have to continue that rehab. They have to continue supporting each other and the patient throughout this journey to get to the other side to live a normal life again.
And how do you manage scarring and contractures?
So the first point is the scar massage. So once the wound has healed, we give the patient emollient cream, or the other good thing to use is virgin coconut oil, which has a nice oily base to massage the skin. So we teach the parents or the patient themselves to massage over the area that has been burned. That's the first step. Then later on, our occupational therapists assess these patients. They often have something called pressure garments. So pressure garments is basically like Lycra that they put on, very tight, that must be around that wound. And it prevents something called hypertrophic scarring. Hypertrophic scarring is when that scar bed raises. It looks terrible, it can impair function, and it's incredibly itchy. So these patients have to wear it for 23 out of 24 hours. So it's very labor intensive. It sits very tight, but it's so essential for the care. Contractures, just to explain what a contracture is. So contractures is when a wound heals in an abnormal position because of thickening of the skin in that area. And often, so it's a 2-year process. We try and prevent these contractures or make them soft enough to resume normal function. After 2 years, if these contractures are thickened and hard, they have to go for contracture release. And that is an additional operation that needs to be done by the plastic surgeons, where they go back to theater and they get an operation to release the skin in that area so that we can have normal function.
You guys also try as much as possible to restore the limbs and not have them amputated.
Sometimes it's impossible to avoid it, but as much as we can, we want a patient to return to normal life with their normal limbs and everything. The problem is, especially in severe flame burns, where it's burned down to bone, often it's not salvageable. Or especially the electrical burns, where especially the digits, so the fingers and the toes, are completely dead. Then we have to amputate them, because if they stay, that becomes a source of infection and a source of pain.
You have had so many years of experience in the field. Can you share a memorable story or success story from your experience?
Burns is always a roller coaster because we have many sad stories that I go home to and cry about to my husband. But we do have a lot of amazing stories. And one of the most memorable is a little kid we had quite recently, hot water burns on a whole four anterior aspects, so abdomen, legs, and arms. We had to take her to theatre 3 times because she had ongoing infection as well. And she came back running into clinic and she wanted to visit every ward that she was admitted to give everyone hugs and show them that she's fine again, running in with a little sundress. And that is what we live for. That is what we strive for. It's for someone who has gone through so much to joyfully return back to normal life.
Wow, that's so touching. The Pulse Show is going to take a short break, and when we return, we'll be back in conversation with Dr. Anika van Vuren, a dedicated surgeon, sharing everything you need to know about treating and surviving a burn.
365.
This Eid al-Adha, donate your Qurbani to Africa Muslims Agency. Our Qurbani program empowers local farmers, providing training and a sustainable income. We educate communities on the rights of Hajj and Udhiyah and uplift them with the gift of nourishing meat. Sponsor in South Africa, Sudan, Gaza and more. Prices start at 2,000 Rand per share. Donate your Qurbani with Africa Muslims Agency and let your sacrifice bring empowerment, education and inspiration.
Al Foundation Outreach in collaboration with IMA Clinics presents a wellness support program for our communities. Free health screening and health education day. Saturday, 23rd May 2026 from 8:30 a.m. right until 1 p.m. Taking place at the Al Community Hall, 189 West Road, Overport. Snacks will be provided. RSVP to radio@alansar.org.za or 083 669 4496.
لبيك اللهم لبيك.
Are you going for Hajj or Umrah? We at Al Ansar Shop have got you covered. From ihrams, ihram belts and kitabs. We're also stockist of Zamzam water from the wells of Mecca, dates from Medina, all at a ridiculously low price. Visit us at 207 West Road or call us on 031 208 1601. Al Ansar Shop, your one-stop Islamic shop.
The Sunday Lounge with Salma Kazi Wahab. 10 to 12, latest Nasheed, celebrity artist features, events, music from the Nasheed world, top 10 countdown. Sunday Lounge with Salma Kazi Wahab.
Radio Al Ansar, 24/7, 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
ما يقال عندي بسم الله بك هنا بدأ في سلطان جسدي مع الزكي يا عين وحدا تبني شهادة فوق شهادة يا محمد يا سيدي صلى الله عليك صلى الله عليه سيدي صلى الله عليه اللهم صل وسلم طول سهر على نبينا نجوم الليل واستخلاف الحوت الأبكار بحور الغامضين محمد يا سيدي صلى الله عليك الأبدا محمد يا سيدي صلى الله عليك الأبدا ما يوفى بيك نبدا حبك في سلطان جسدي مع الزكية عين عليك نبدا يا محمد يا سيدي صلى الله عليك
And we're back. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 in Pietermaritzburg, 105.6 FM. I'm Shubnum Ismail on the Pietermaritzburg Pulse Show, capturing the heartbeat of our community. So joining me today in studio is Dr. Van Vuren, a general surgeon, and we're acknowledging National Burns Week by sharing information on burn care. So our expert doctor has been in the field for so long and has the knowledge and expertise to actually share what we can do for prevention and treatment of burns. Welcome to the show, Doctor, and it's great to have you with us.
Thank you. It's been a pleasure.
So can you tell our listeners what's the most critical aspect of burns care that the public should know, and how does your facility educate the community on burn prevention?
So firstly, we've spoken a bit about how they can help with prevention of burns. That's absolutely essential. Then that first aid is another part that's crucial. And then the other place where the community can play a big part is once someone has been admitted with a burn injury, especially parents. A big problem often is that there's a lot of judgment and resentment, and these parents are so in need of support. If you have a family member or a friend that does have this unfortunate event happen to them, realize that they're in such a place of needing support in any way possible in that season of life. And then after the hospitalization in the healing process, when we see these patients, to remember that these burns are battle scars, to try and go beyond our prejudice and not just judge on scars and treat people differently, but actually respect these people for what they have survived and what they have been through.
And how do you stay updated with the latest advancements in burns treatment?
We have quite a bit of congresses and courses, especially Zoom enables us to go on an international platform quite easily. Reading journals and submitting papers to journals is also a very helpful part. And then our international collaboration, especially with global surgery and with interburns. It's so interesting to learn from specialists in other countries and to then also hone in our skills on what we can do in our setting that we can improve on or that we can do differently to help our patients.
So what is the importance of teamwork at your burns unit?
It's crucial. So every week, at least once a week, we have a meeting as a whole team. But throughout the week, we're in constant communication about every patient, about what their specific needs are, whether it is a nutritional need, whether it's a mobilization need, and sometimes an emotional support need, especially if it's patients that, children that do not have family that's close by. We try and be a bit more present for those children, to just be there, give a little bit of extra love, but also to give some parents a bit of extra support, especially those who do not have family that can visit them, to try and emotionally carry them through this period.
And can you tell us about any innovative treatments you're currently using?
So except for our normal skin graft that we usually do, there is a technique called meek grafting. It's unfortunately very expensive, But in some patients where they do not have enough skin to transplant on other areas, meat grafting is essentially micrografting. So what it does is it chops the skin in tiny little squares and we transplant that, and it means that we can expand a small area of skin can cover 6 times what it normally would have. And that makes a big difference in the healing process for the patient.
And how does the hospital support long-term follow-up for the burns patient?
So with our burns clinic, we follow patients up at least 2 years after their burns, especially anyone with a deeper burn. But what we also do at our clinic, and at least we have quite a bit of freedom regarding that with the hospital, is we have an open door policy. So every patient I discharge know that my clinic is on a Wednesday, and if they have any problem or any concern, they're always welcome to come through on a Wednesday. We'll see them and see how we can help them and adjust to the problem.
And what's the role of nutrition in burns recovery?
We've touched on this a bit earlier about how some patients require an additional tube feeding just to meet their requirements. And that's often a bit uncomfortable, and because it's difficult to understand because patients can eat, but then they also need the tube, is that if you don't have enough protein, your body will take it from somewhere else, which means you will lose muscle and you'll end up being emaciated. So that's why additional feeds throughout, and we sometimes give peanut butter as discharge or extra protein just to carry patients through that healing process. Because often we have something called a hypermetabolic syndrome that a patient can have for up to 2 years after their injury, which means the whole body has increased needs. So as they go home, they need to eat more protein, they need to take extra fat, and sometimes in low resource, in low income areas, that is very difficult. And our dietitians try and adjust what the patients can afford and what is in their natural diet or their normal diet to try and accommodate for that.
And how do you handle pediatric burn cases differently?
I think emotionally, it always hits a bit deeper whenever there are children. And then the fact that you've got more than one patient. You've got the patient in front of you, but you also have the parent. And the parent not only needs to be counseled through, but they also have some form of stress disorder after this that need to be addressed and carried through.
And Doc, is there any final messages you'd like to share with listeners on National Burns Awareness Week?
I think firstly is that prevention is better than cure always. And there's so many small things we can do that can make a difference. It's the small things of just being cognizant of when we're heating water, when we're having any hot beverages, when we're working on an oven, just to be aware of where the kids are, where patients with epilepsy or elderly are when we are busy doing that. And cold water on that burn initially is essential.
And I do believe that you accept donations, teddies, blankets, just to actually comfort your patients. Would you like to elaborate a little bit about that and how the community can get involved at your facility?
So our patients often stay for months on end, and they have very little support because some of them come from very far. So we would always accept donations in forms of clothes, blankets, or toys for these patients to entertain themselves. Unfortunately, our wards are very dreary. There's no TV screen. So old books would also be very appreciated for our adult patients to keep them entertained through this period. And yeah, if there's any donations for the burns unit, that would be amazing.
Doc, every step or small step towards healing is a victory. So your team, your strength inspires us all to keep pushing boundaries and helping with burn care. As we wrap up today's discussion on burns and trauma, I want to thank Doctor and her trauma team for sharing their expertise and insights with us. It's clear that prevention, prompt treatment, and proper care can make all the difference in outcomes for burn patients. To our listeners, we encourage you to prioritize fire safety, be aware of potential hazards, and know what to do in case of an emergency. Thanks again to Dr. Van Vuren for joining us. Your knowledge has been invaluable. So until next time, stay safe and stay informed. And how can listeners get in touch with you if they need to get to know more information?
The easiest will be to get in touch through the hospital or through our burns unit. I'll perhaps supply my contact details to supply on the website. If anyone would like to get in contact, that would be amazing.
Wonderful. To our listeners, shukran for tuning into today's episode. Healthy choices, brighter futures. That's our motto here. And we believe that taking care of your health is one of the most important investments you can make. Mother's Day Mubarak to all of those tomorrow, and make dua for all our mums, including my mum, Fatima, inshallah. Happy birthday to our precious sister, Azra Mia, who celebrates her birthday today. Jazakallah to our technicians for connecting us to the community. Until next Saturday, inshallah, we will be talking to you again. Have a beautiful and Mubarak and a safe weekend from myself from the Pulse Show. Assalamu alaikum wa rahmatullahi wa barakatuhu.
On the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.
اللهم انصر إخواننا المستضعفين